Before I get into the specifics of this Medicare plan that millions of people are still on and could be wasting money, I want to make sure that anyone that's on this plan knows and really understands that that plan, when you originally went on that plan, was probably the best decision. In fact, it made a lot of sense for millions of people. However, Medicare has changed some rules recently, and because of that, this plan is probably no longer the best bang for your buck. And so there are other plans today that could make more financial sense. I'm going to explain that in this video. In this video, we're going to answer 6 questions about this specific plan. Question number 1, of course, would be, which Medicare plan am I referring to? Well, of course, these are supplemental plans. There are 10 plans today on the market, and the plan I'm talking about is actually the Plan F. All right, so the Plan F is the one that millions today could be wasting money on. And so the problem is what? Well, the problem is not Plan F's coverage. In fact, Plan F covers very, very well, as we'll see here in just a minute, but that's not the problem. Secondly, the problem is not the carrier that you selected, whoever you went with, that's also not the problem. What the problem is that Medicare changed their rules. And so because the F plan was such extensive coverage, Medicare decided that they no longer wanted a plan where there was full coverage. And so what they did a couple years back is they made a rule change. And what they said is that anyone that is starting Medicare 1/1/2020 or after could no longer get the F plan, which basically means this: anyone that was born after January 1st, 1955 and starting Medicare at 65 could no longer get the F plan. Now, what they did do is, though, they grandfathered in all those that were prior to January 1st, 55 birthday, starting Medicare before 1/1/2020. And so this group was all grandfathered in. So anyone who had an F plan can keep that F plan. They'll never lose that. It's their plan for life. Okay, but anyone coming new into Medicare is no longer eligible for the Plan F. And so that's the problem. The rules changed. All right, that brings us into question number 2, and that's this: why are millions of people still on Plan F today? Well, the reason for that is because they haven't switched and because the Plan F is such good coverage. So what I'm going to show you are the gaps that exist in original Medicare. So when someone enrolls in Medicare A and B, other than preventive services, Medicare doesn't cover anything 100%. There's always a gap of financial responsibility that the insured is going to have. And so this graph, this grid here, actually represents the gaps in original Medicare. I'm not going to look at all of them because I think it's mindful for most people that Medicare has gaps. But what I do want to point out is Part A is the hospital side of Medicare. So this is going to be for hospital bills as well as skilled nursing facility bills. Part B, they call this medical. Okay, and this is going to be pretty much everything that's going to be outpatient, all right? So that's the outpatient side of Medicare. Part A is going to be the inpatient side. And what you're going to see is that there's three gaps on the A and there's 3 gaps on the B. So if I go to the hospital, I've got a deductible. If I'm in the hospital longer than 60 days, month 3, month 4, and month 5, I have daily copays. That's a gap. And then if I go to skilled nursing, Medicare covers the first 20 days as long as we've been in the hospital 3 midnights or longer. But now the next 80 days, I've got a gap of $204 a day copay. On the B side, we have a deductible again, $240. That's once a year. By the way, this deductible can happen multiple times. This one just once a year. Then after that, Medicare only pays 80%. I have to pay 20%. And then there's a possibility of going to a doctor that can actually add to the bill an additional 15%. So those are the 3 gaps that are on the B side. And here's the point. Anyone that enrolls in original Medicare A and B is going to be responsible for these gaps. And so what the Plan F does, it fills in all the gaps. So this is what that F plan looks like. It's full coverage. In other words, anyone that is on an F plan today should never see a bill. As long as Medicare paid first, that Plan F is going to fill in all the gaps. It covers all the gaps on the A and all the gaps on the B. And frankly, this is why Medicare wanted to get rid of the F plans, because they wanted there to be some other skin in the game other than someone paying a premium for a plan. They wanted there to be some additional things out of pocket. And so that's why they changed the rules. Hey, if you found this video helpful and if you want to see more Medicare information just like it, then go below, right below the video, and you can give us a thumbs up as well as subscribe to our channel. And every time I put a new video, which is about 2 every week, you'll be notified of that video, and others just like you who need this vital information will get it as well. So that brings us into question number 3. What's the problem with the Plan F today? Well, here's the problem. The premiums, the monthly premiums that people are paying are increasing more quickly than other plans that are on the market. And the reason for that is because those groups are shrinking in size. They're also groups that people are getting older, because anytime we buy a supplemental plan, what's basically happening is this: you're going into a group. And so as time goes on, this group gets smaller and gets smaller and gets smaller. Why? Because people pass away, people change plans, and people just get off of these kinds of plans. And so the point is, this group is shrinking. And therefore, when we have health problems in a group that is shrinking, then the risk of those healthcare costs are just spread out to the policyholders. And when there's less and they're aging, we're going to see more and more claims in these groups. Now, thirdly here, also, I believe the full coverage, this F plan, the coverage for that is too expensive today because we have some other options available, as you'll see here in just a minute. But right now, that Plan F covers 6 of the 6 gaps. There is a plan, you'll see here in just a minute, is it'll cover actually 5 of the 6 gaps. And the only difference between this Plan F and this plan over here, which is called the G plan, notice it's just one gap. And so that one gap is called the Medicare B deductible. This year, that Medicare B deductible is only $240 for the whole year. And so if I have an F plan, it covers that B deductible. The G does not. But notice, if I can save at least $20 a month on the G plan, that's enough to cover my B deductible. And there will be definitely more than $20 a month between those two premiums. So here's my point. I believe now to have that full coverage plan, though we like it, it's just simply too expensive. There's a better value if someone can get approved. All right, so that brings us then to question number 4, which is really obvious. What's the purpose of switching? Why would someone want to do this? Well, the main reason is because they can actually save money and save substantially money now on monthly premiums. We ought to be able to see those premiums go down anywhere from $40, $50, $60, sometimes $100 a month. So we're talking, if we're saving between $50 to $100 a month, that's $600 to $1,200 on an annual basis. And so we can save money now. But really, equally important, maybe even more importantly, is this: we can save substantially over the long term. The average life expectancy right now for people that are on Medicare is between 85 to 87 years old. And so the majority of people are going to live a long time. And so we can save money now, but over the long term, if we go into a different group that's going to be a larger group and a younger group, then I think we're going to see more price stability in a new plan. And so again, over the long haul, I think we can save thousands and thousands of dollars by making that switch. All right, that brings us then to question number 5, and that is this: what supplemental plans are most popular today? Again, you saw the letters. We have supplemental plans A, B, C, D, F, G, K, L, M, and N. But the majority of people right now are getting a G plan. In fact, 70% of the people getting supplemental plans today get G, and then 30% of all people are getting N plans. Those are your 2 popular plans. So there's many available. Of course, as we talk about it, you got to be born before January 1st, 55 to be even eligible for those particular plans. If you're born after January 1st, 55, starting Medicare after 1/1/2020, then we only actually have 8 options. But again, those 2 are the most popular today. All right, so let's talk first of all about the most popular one, which is, of course, the G plan. And again, you just saw this earlier. This is that Medicare grid representing all the gaps that exist in original Medicare. And if someone doesn't have a supplemental plan, they're actually responsible for all those gaps. Now, remember, the Plan F filled them all in. But right now, the G plan does this. What it will do, it'll actually fill in all but the Medicare B deductible, and that's it. And so for the rest of your life, if you have the G plan, the only thing you'd ever be responsible for would be that Medicare Part B deductible. And again, it's an annual amount. You don't pay that any more than once a year. So the first $240 of anything that's billed to the B of Medicare would be your responsibility if we have the G plan. And then once you have met that deductible, then you can see everything else is covered. So on the F plan, you never saw a bill. On the G plan, you would see bills up to $240, and then you're done. All right. And so there's very little difference. So it's not quite full coverage, but again, it is going to be very close. And remember, regardless of the carrier that you would choose, whatever carrier insurance company you go with, that G plan coverage is going to be the same because Medicare standardizes the coverage. Just like whatever F plan company you chose, you had full coverage. If we have a G plan, whatever company you choose, again, we're only going to be responsible for that B deductible. And then one last note on this, that B deductible will reset every January. And so once we've met the 240, we're done for the year, and then it's going to reset. And sometimes it goes up and sometimes it goes down. I'm shooting this video in 2024. This actually read in 2023, $226. So it actually went up about $14. So we see it go up and we also see it go down. But again, it's a very small deductible, only once a year that we have to meet it. Hey, Medicare can be very confusing. In fact, people make mistakes all the time because of how confusing it is. So what I've done is I've actually created a Medicare, notice this, Essentials Workshop, where you have the opportunity to really learn everything that you need to know about Medicare so that you can make Medicare decisions. There are thousands of people every month that watch this workshop, and we get lots of reviews saying that this is something that really was helpful to them. And so what you can do is down here below in the comments section, you'll see where it says pinned comment. At the very top of those pinned comments is a link. And you click on that link, what we're going to do is we're going to give you free access to this Medicare Essentials Workshop. And we want you to watch it because we don't want you to make any mistakes. All right, that takes us to another good supplemental plan option, which is called the Plan N. Again, you've seen the grid. These are gaps. So the way the In Plan works is it is going to cover 4 of the 6. F covers 6 of 6, G covers 5 of 6, N covers 4 of 6. So you can see if you have the In Plan up here, you're going to meet that deductible for the B side once a year. And then if by chance you go to a doctor that adds to the bill, now I will tell you the majority of doctors do not add to the bill. We do not see excess charges often. About less than 5% of the time will we even see an excess charge. It can happen, and it does happen. We see it primarily in specialties, especially cancer type docs, but this means that if you had the In Plan and you experience an excess charge, that additional 15% added by the doctor, then you would be responsible for that. Remember, G paid it, F paid it, but N does not. And then in addition to that, N does have a couple of other copays. And so the In Plan copays right now, when you go to the doctor, you're subject to a copay up to $20 a year. And again, you're on the In Plan the rest of your life. Every time you saw a doctor, you'd see a copay of $20. And if you went to the emergency room, you'd have a copay up to $50 unless you're admitted to the hospital. If you're admitted, then they waive that copay. So the whole point is this: people who choose the In Plan are taking on just a little bit more risk, not a whole lot more, but they're also going to save some money on a monthly premium, all right? And they'll just take on some copays. And so again, the difference, and this is going to vary, folks. We're a nationwide broker, but on the average, I would say the difference between the G Plan and the In Plan is going to be in the neighborhood of about $30. Could be a little less, could be a little more, but about $30. So we're going to save $360 a year. We're taking on the risk, a slight one, of excess charges, and we'll have some copays as well. So what I have found is that people that don't want to have any surprises knowing this may happen, that just want to know I've got as the most comprehensive coverage that I can get, are typically going with the G, and those that are saying, yeah, I like the $30 or $40 a month savings, I'll go ahead and go with the In Plan. So both are fine options. You really can't make a mistake either way. Just have to decide what's really most important to you. All right, now let's look at the last question, and that is this: what is involved in this process of switching the plan? Well, the first thing you have to do is apply. You can't switch unless you apply. And so what we would do, and if, again, we would be delighted to help you with this process, is we'd actually look at different carriers. We'll look at the health questions, because most carriers are going to have about 30 health questions that we're going to have to answer. Okay, and so so they're going to look at your health issues, what your pre-existing conditions are, and then we're also going to have to look at all the prescription medications that you're taking now or have taken in the last 2 years. And sometimes we have to actually get what's called a attending physician statement, an APS, by your primary care doctor to explain something that may be going on with your health. Again, this is not often, but these two things will be with every application. So we have to decide which carrier that we believe is going to approve your case, but you have to apply. Now again, if you're on a Plan F right now, we're not going to cancel that. You keep the Plan F. We're just simply going to start the process to see if this is something that we can get approved. And I'll be frank with you, there are some insurance companies that are a little more strict than others. And so if we see something that may be a little borderline with one company, we'll try to find a company that is not a big issue. I'll give you a great example. Sometimes for men, they'll ask a PSA level. And if it's real high, some carriers won't take it, but some carriers don't even ask that question whatsoever. We'll find sometimes with ladies, if we have an osteoporosis diagnosis, some companies will take you as long as there's not been fractures. Other companies, if you have osteoporosis, it's going to be declined. So the whole point is this: we do our work to make sure we try to find somebody that when we apply, we can get you approved. Now, I want to be honest in that we don't make the final decision. We do what's called field underwriting. We go through this process of questions and prescriptions so we can submit this information to that insurance companies, to their underwriting department, because they're the ones that have to give us the final approval. So again, we do field underwriting, but we have to get approved. And again, it doesn't cost anything to apply, and if we submit that information, then that is in the hands of the insurance company. And in all states but 4, they do have the right to say no, just so you're aware of that. In New York, Connecticut, Maine, and Massachusetts, they don't have to say no. They actually, we can always get those cases through. But in all the other 46 states, including the District of Columbia, when we want to switch plans, we're going to have to approve. So when we get off the F, go to the G, or get off the F and go to the N, again, we're going to have to go through that approval process. And again, we would be happy to walk you through the entire process and find an insurance company we think we have a good shot with. Okay, now here's what's going to happen. If we get approved, start saving money. Again, short-term premiums are going down. Long-term, you're going in a new group that's larger, that's younger, and so I think you're going to see some great savings over the long haul as well. And then if you don't get approved, we just get declined. There's no harm done whatsoever because nothing has been canceled. You simply stay on that Plan F. And Plan F is still a wonderful, wonderful plan. It just is. But I think there's a better value for you through the G or the N if we can get you approved. So I'd highly recommend that you go on our website here and you can schedule an appointment, or you can call our 800 number, 800-864-8890, and you can schedule a free appointment with one of our licensed Medicare agents, and they can talk about this entire process and see if we can't get an insurance company that you can switch to and start saving that money.